Hi, I'm Congressman Bobby Scott, member of Congress from the 3rd Congressional District of Virginia, live from the United States Capitol, where we're considering the Affordable Care Act. Now, when they talk about repeal and replace, the first thing that they will do, obviously, is repeal. And we need to review what happened before the Affordable Care Act and where we were. Costs were going through the roof. Those with pre-existing conditions couldn't get insurance. Women were paying more than men. And millions of people every year were losing their insurance. After the Affordable Care Act passed, costs have continued to go up, but at the lowest rate in 50 years. Those with pre-existing conditions can get insurance at the standard rate. Women aren't paying more than men, and instead of millions of people losing their insurance every year, 20 million more people have insurance. And so if you're going to do anything about the situation, you want to make it better, not worse. Unfortunately, with the proposals to replace the Affordable Care Act, actually they will make things worse and may even destroy health care for everybody. One of the things that you learn about health care policy is that if you're going to cover people with pre-existing conditions, you can't let people wait until they get sick before they buy insurance, because people will wait until they get sick before they buy insurance. The average cost for people with insurance goes up, and it spirals out of control every time they've tried this in New York, in Washington State, and several other states. It lasted about 2 or 3 years before the entire system spiraled out of control. In Washington State, after a couple of years, nobody could buy insurance. In New York, when they went in with the everybody had to buy insurance policy, the mandates, the rates went down more than 50%. So the entire basis of the replacement plan makes no sense. You have other problems with it. You're cutting taxes, less support for insurance, which means fewer people will be covered because you have less money for Medicaid, you have less money for the subsidies to help people who can't afford to buy the insurance, so people will have less coverage. You also have fewer benefits. The Affordable Care Act has an essential benefits package. The proposals before us eliminate most of those benefits, and so you'll have less benefits. You have less benefits, higher cost, fewer people insured. It is a complete disaster. We need to keep what we have, and if we're going to do any better, let's see a plan that actually works before we replace.